Dr. Ashcraft, good to see you.
Hello, everyone. Good to see you.
I disabled the waiting room, so I will monitor closely.
Got it. Well, we have a password and I think we're good. We're good for this one. All right, we got to the top of the hour. So in the interest of time, I'll go ahead and get us started as people continue to trickle in. Welcome everybody to a PISCE at LDI Fireside Chat. My name is Megan Lanefall and I'm the Executive Director of PISCE at LDI. And I'm so excited to have you all here. We have three dynamic speakers who are going to be a part of our panel, and I'm going to introduce them, and then we'll start off with some questions. I want to invite you all to put questions in the chat, and I will moderate the conversation and moderate the chat, and hopefully we'll have a nice back and forth here. So our first of three featured panelists is Dr. Kevin Ahmad Jenkins. He's a dynamic speaker, author, and scholar. He's a lecturer at Penn and a core investigator at the Center for Health Equity Research and Promotion, or CHIRP, at the Corporal Crescent's VA Medical Center in Philadelphia. Dr. Jenkins is appointed in the School of Nursing and the School of Social Policy and Practice, and he's an associate fellow with LDI. He's also the director of the Interpreting Attitudes Toward Minorities in Medicine Research Group. Dr. Jenkins' research examines the influence of race, racism, and psychosocial stress within medicine. Dr. Jenkins has led research studies that analyze how stress interacts with vascular-based diseases like heart disease, chronic kidney disease, and diabetes, and Alzheimer's disease in high-risk subgroups within the Black community. To best understand how racism makes people sick, Dr. Jenkins and his research team have worked with former professional football players, veterans, and people living with vascular-based diseases to create family-centered, culturally sensitive, and competent interventions. Our second featured panelist is Dr. Courtney Boen. She's an assistant professor and Axelrod Faculty Fellow in the Department of Sociology and Graduate Group in Demography, a research associate in the Penn Population Studies Center and Population Aging Research Center, and a senior fellow at LDI, and an affiliate in the Center for the Study of Ethnicity, Race, and Immigration. Dr. Bowen's current research focuses on a few different areas. The first is interrogating the role of the U.S. criminal legal system in population health inequities. The second is investigating how shifts in immigration policy, surveillance, and enforcement over time across the U.S. have patterned racial and ethnic and legal status inequities in health. And the third is examining the roles of life course, economic, and stress exposures in shaping longitudinal population health disparities. Together, her work aims to improve understanding of the social and political factors generating population health inequity and offers insights into potential leverage points for ameliorating health inequity. And our third featured panelist is Dr. Katelin or Katie Hoskins, who's an assistant professor in the Department of Biobehavioral Health Science at Penn Nursing, a senior fellow in the Leonard Davis Institute of Health Economics, and a good friend who teaches equity and implementation science. Dr. Hoskins' research goals center on partnering with organizations, clinicians, families, and community members to equitably implement and scale up evidence-based interventions to prevent youth suicide, with a specific focus on firearm-related lethal means safety. As a psychiatric mental health nurse practitioner, clinically rooted observations of the landscape of mental health service delivery motivate Dr. Hoskins' research agenda. Her experiences caring for children and adolescents have amplified the importance of context, like social, historical, and political context, and shapes the questions that Dr. Hoskins pursues as a nurse scientist. Across her scholarship, she employs implementation science frameworks, mixed method study designs, qualitative analytic approaches, and behavioral economic tools. So we have a powerhouse of a panel here with us today. Our coordinator, Izzy, I'm going to ask you to spotlight our panelists, if you could, for the group. And I'll ask our panelists to consider the first question, which is, what are some of the biggest barriers you've encountered in working to advance health equity? And as you think about that, feel free to, add a little bit more color about the research agendas. I couldn't say everything that you study, so feel free to add some introductory comments if you want, but if you could help us understand kind of what you're facing as you think about health equity, that would be great. And I'm going to start, I'll use first names because I used the doctor already, so feel free to call me Megan. I'm going to start with Kevin, if you can tell us what some of the barriers are you've encountered.
kind of knew you were coming. Well, first off, thank you so much for having me. You all got my old bio, but the good thing is I'm teaching the health equity course over in the School of Medicine, and that's where I primarily hold my lectureship appointment. And I think it's important to understand that there are several pieces that, from an implementation standpoint, that just continue to be a problem when it comes to DEI. And the first is just this false assumption that we're ready, right? Because some of us think that just having the conversation about diversity, equity, and inclusion, therefore checks the box. And that's not enough, right? Because now you're asking people to, uncover some really hard conversations that 40% of our workforce has already stated we never had and I don't want to have, because we know there's no accountability tied to it. So I think that's one of the pieces. The second piece is just an empathy issue. What's been exposed and what I believe in implementation science in DEI, what we've been able to see is really an empathy gap. It's not as though we don't have the evidence. It's not as though we don't know what the statistics have told us. It's not as though the disparities that have been going on have not been going on for centuries at a time. So it's not about the evidence, because we have the evidence. Do we have the empathy? And that's what implementation science has really been able to show us. And that's something we were able to see in some work we recently did with our research team did, where, we asked a simple question. If you find an employee has violated the assumptions of your new DEI program, would you fire them? They literally asked us to remove that question from the survey, right? Because again, we're cool with making, Black and brown people cry all day. We're cool with making folks from the LGBTQIA community cry about their discrimination and the things they face. But oh my gosh, like, what happens when somebody really does something wrong when we go to a certain place and they tell us that you have a manager that's trying to fill out a form to say they can't have any gay people on their team because they don't know how to manage them. This is the work we're doing. A lot of the uptick of DEI is failing because of the lack of empathy. And that's where I'll stop.
I knew you would bring it. I appreciate it. So I'm hearing readiness, and I'm hearing sort of echoes of the trans-theoretical model and the empathy gap. So I'm going to take notes. Let's go to you, Courtney.
Great. Yeah. So first, I also want to just echo the thanks for bringing us together. This is a great conversation. And I'm also just looking forward to learning from folks working in different disciplines. But I think we use different language sometimes in ways that can create barriers. So it's also just nice to be in an interdisciplinary space. So my work, so I'm a sociologist. My work tends to sometimes take what I think about as more of a 20,000 foot view, in the sense that I'm really thinking about the structural and institutional forces generating population health inequities. And so, as you pointed out, Megan, like a lot of my work recently has been thinking about the role of the criminal legal system and how state incarceration policies, as an example, generate inequities in population health. And also thinking about, what are those policy levers that can bring us closer to equity? I totally empathize with a lot of what Kevin already said. I think what I'm about to say is probably really related, in the sense that for me, the challenges that, and these are, I think, anticipated, but I didn't quite realize how hard the struggle would be, are political ones. The science, as Kevin pointed out, is not enough. It's just not. And I think we can take the naive view that producing high quality science is going to be enough to push people to implement the types of interventions and policies that would make a difference. And it's just not. And so, one enormous challenge that I felt myself even more grappling with in recent years is trying to think about, like, how can I work alongside folks who are the experts in encouraging and putting political pressure on those who hold political power to implement these changes, to make the fixes that we know would work. So for me, that's honestly been the biggest challenge. And, I think building off of what Kevin said, I mean, these political fights are undergirded in the roots of which are built on notions of white supremacy and racism, of sexism, of capitalism, right? And so there are folks that fear that they have something to lose by implementing some of these policy solutions, right? And so for me, you know, these political fights often go beyond just sort of how do we do that, you know, we don't have enough funds or you know, or how do we do this, but are sort of undergirded with and central to the questions and fights are related to sort of what Kevin mentioned, which is like who deserves to be seen and treated as fully human. And that's a real pernicious, nefarious, volatile political fight. And so anyways, that's all to say that for me is like the central challenge. And I'm happy to talk more about, you know, sort of how I think I've tried and more recently to be better about working with the folks who I think are better positioned and have a better, have more experience doing sort of the social and political organizing that I think is necessary to sort of overcome that as a barrier. So I'll stop there, but looking forward to coming back to it at some point.
Courtney, thank you for that. The concept that the science is not enough is really powerful, and I think a lot of us feel that, and it'll be interesting to see. Hopefully we'll come back to that in the course of the discussion. Katie.
And thank you again for including me. I'm really eager to learn from this group and from folks in attendance today. So I kind of following that thread, I'm really interested in this challenge of applying ethical values like equity to restructure clinical practice and care delivery. And so what I've been grappling with as a novice implementation scientist is what does it really mean for us to do equity-oriented work in implementation science with a particular focus on clinicians and organizations when the foundation of our efforts is cracked. And you know, to that point, Dr. Melissa Creary from University of Michigan has had a paper that came out a year or two ago in the Journal of Law, Medicine, and Ethics that I think is just, it's so relevant to the work we do in implementation science. And she proposes this idea of bounded justice as a concept and analytic framework. And it suggests that it's impossible to fully intend to fairness, entitlement, and equity when the basic social and physical infrastructure underlying them have been eroded by racism and other historically entrenched isms. And so I think this really calls for us as implementation scientists to get clear on our goals around delivering small slices of justice, as Dr. Creary has said, as we work to make changes amid organizational constraints that are layered onto and often the result of greater socio-historical constraints. And I think we see this alignment of bounded justice and newer conceptual frameworks in implementation science, like the health equity implementation framework and the racism conscious adaptation of CFR, that really call for us to identify racism and power dynamics as key contextual determinants that have to be interrogated in our implementation processes. And to that end, I think we have work to do within the field of implementation science as we really think about how to precisely define and then operationalize this bigger concept of equitable implementation, because there's important implications for then how we select our frameworks, or how we measure our outcomes, and then situate our results that allow for interpretation amid a bigger socio-political and historical fabric. So I'll pause there and just say I'm so eager to have this discussion today and learn from the group.
So thank you all for the introductory comments. Katie, I love the idea of bounded justice, and the concept of small slices of justice is really appealing in some ways, but it also makes me think about, as you mentioned, the cracked foundation, how much of this work should be done within a flawed system and how much of it should be done outside of the flawed system, maybe on the system and trying to maybe affect policy changes the way that Courtney talked about. So I'll open up the panel and ask you all, what are your thoughts about working within systems that are potentially, founded on principles that a lot of us would object to in terms of thinking about white supremacy or other types of marginalization? What are your thoughts about working within systems built there versus trying to affect change from without?
I think it's important to remember Audre Lorde's famous quote where she said, "The master's tools will never destroy the master's home." And what we're doing is we're fighting with the same conversations, right? We're fighting even when we welcome the conversation of DEI in air quotes. We forget the anchor is in the middle, that's equity, right? Equity within itself. And I like to try to give a definition of equity and where I stand on it. And I'm a tall guy. For those who know me and you've seen me, you know I'm tall. So I'm really tall. So every time I go to the grocery store, I literally have somebody asking me to help them grab something on the top shelf. Never fails. And I'm okay with it because that's my duty as a tall dude, right? So all I got to do is reach up, grab whatever it is, we make a joke, give them their stuff, and they move on. But I usually know by the look on their face whether they need help, right? You usually understand it because you've seen it before. You've allowed the experience to ruminate within you, so you don't make that person ask for you to use your reach. The issue that I have in working within systems is what we're talking about are not errant numbers of disparate outcomes. What we're talking about is we promise people that come into our healthcare system, I will reach for you when you can't reach the top shelf. But what we're also saying is that with the DEI conversations and the subsequent frameworks and investigations is what we found is that we reach for some and then arms folded for others. How do we use our reach within organizations? No, facing that literally didn't welcome me. What is diversity? Diversity within itself, and I thank Dr. Eve Higginbotham and I salute her for really taking care of me throughout my tenure at Penn. And I hate to see her leave in her retirement, but I wish her well. But the thing she taught me is that inclusion comes before diversity, because you can't have inclusion without diversity. And I always say now that diversity without inclusion is simply decoration. And all we're doing is decorating the halls with people who come in, but you don't want to hear the voices. So how do you work from within? Please understand, if you're doing that work, it's tiring. If you're doing that work and you're trying to publish and you're trying to meet with students and you're trying to meet with other faculty and you're trying to meet with community people and the media, like this stuff gets real. I've been on the bad side of the top 12 anti-vaxxer list. I received the death threats when my wife was 7-8 months pregnant, and I brought it to my folk and they laughed at me. I dealt with it in 2018 when we was on the bad side of the Fox News cycle. And then in 2021, I got Anon adding me, celebrating me. And that's when I knew something was wrong, right? I was like, QAnon is like, we love you, and Anon is like, we hate you. And I was like, who is Anon, right? But these are the parts of doing this work within the system that we have to be willing to support as well. These conversations don't just happen. They happen at the expense sometimes of our own discomfort. And trust me when I say, if it's uncomfortable for you to hear it, it's way more uncomfortable for me to check my emails and to check my social media and to go places and not know where I'm going into, where I'm being told I'm traveling to Arkansas to speak for the Arkansas State Hospital Association, but they told us that we were sundown town. This is real, and it just happened in December, right? When we just finished up a contract for the health equity report for the Pennsylvania Coalition Against Rape. And they told us that, oh, by the way, I know you all are staying a little further west of Pittsburgh. I probably would advise not staying there because that's skinhead country. What I'm saying is we have to remember, we have to support the people that look like us that are on the other side of doing that work. We get the vitriol. And I'm the nice dude on the DEI side, and I'm still getting people talking about they want to kill me, right? So let's not forget that.
Yeah, thanks so much for that, Kevin. I mean, I think what you raise is like a really important point, which I think is like underlying a lot of this too, which is that like the consequences of doing equity work differ, right? Like they're going to look much different for me as a white woman than they are for you, Kevin, right? And so I think recognizing that at the upset is like who has legitimacy in some of these political fights, who's seen as legitimate is like, and who's seen as potentially dangerous or a target, right? Like that is a really important point. And so thank you for bringing that up. I mean, I can talk a little bit about this from the perspective of trying to think about like how, and this is so know that I don't have the answer to this, Megan, and but something that I try to think a little bit about in my own work, which is, you know, a lot of the work that I do is focused on these huge structural problems like mass incarceration as an example, in generating health inequities and in killing people, right? And so ultimately, you know, I see my work as in service of hopefully a movement that aims to undo and rid of these harmful systems and institutions. At the same time, I've also been compelled by arguments from folks who are incarcerated, for example, that like that is all well and good. People are still incarcerated today. And how can we make sure that our work is also lifting them up and not waiting for something bigger than their current needs, which are to be safe, to be fed, to not be in solitary confinement, as just examples here, right? And so, I mean, to me, that's this real balance that I think for someone who thinks about big structural problems, all of us who do, about wanting our work to be in service of broader, bigger movements that aim to dismantle all of the harms and maybe dismantle the institutions sometimes, right? Well, at the same time, recognizing that those fights take a long time and that there are people with real needs sort of dealing with those institutions in the current moment, that I try not to lose sight of, right? And so I guess like for me that the answer about how do I think about working within systems and institutions is sort of like this both and approach, right? Like trying to work with organizers in support of more transformative notions of justice, while at the same time trying to recognize that there can be short-term band-aids that we can put on some of these completely crumbling and harmful systems that could make a difference tomorrow if we did them. Right. And so anyways, that's all to say I don't have a good answer, but I think keeping both the long and short-term vision about what the work should and could look like is something that I try to remind myself of on a regular basis.
Thank you. Gila Netta from NCI just put a comment in the chat that there's an NIH initiative that's an example of implementation science playing out in prison systems, I think relevant to what Courtney was talking about. Katie, I don't want to put you on the spot, but anything do you want to say here about working within versus outside of systems?
Yeah, no, I would build on Courtney's point. I think one of the tensions that I see in my work is this urgency around like real problems and this need for immediate solutions that we know are short term and don't fully address like the bigger, more entrenched structural problems that are ultimate drivers. I do work in youth firearm suicide, which is at its highest rate in 20 years and is an immediate problem. And kids are dying now. There's real urgency around addressing this. And one area in terms of interventions I'm really interested in is partnering with health systems to implement safe firearm storage interventions, which can look like brief parent-directed counseling as well as free cable lock offers. And I think that this is really important work that has the potential to move the needle in terms of reducing unauthorized access to firearms in homes where kids live. But as I've done qualitative work that's part of this project, it's become clear to me that a big driver around why folks have unsecure firearms in their homes is that they fundamentally feel unsafe. And we can do work that makes movement towards improving safe firearm storage, but it's one part of a large, bigger problem around why people feel fundamentally unsafe in their homes, in their lives, in their communities. And until I think we look at bigger issues like community disinvestment,
neighborhood violence concerns for people that if they call the police, they're not going to come. I think that those are like real drivers that we have to be focusing on in partnership with more individual level interventions that we're doing within health systems. So I agree. I think there's this both and tension around where can we work now to potentially make strides while also not losing sight of the longer term work that has to be done in partnership and really digging deep into doing that.
So we have people at all career stages on the call listening to you all. For those that are earlier stage, they get the advice to focus. Just do one thing. The both and approach you talk about, which makes a whole lot of sense to me, could be, a little bit frustrating for someone who's being told to focus. So I'm curious if you all have some very concrete ideas for people who find themselves interested in equity, who find themselves experiencing this tension that you've all talked about, where they want to do something that has impact now or in the short term, understanding that there are systems that need to be potentially dismantled, upended, dealt with. How would you advise someone who wants to work in this space to maybe be able to do a little bit of both?
Just come up to me and say, I'm going to listen to the replies here and absorb as much as I can from the group. I think it's a great question, one I'm like really struggling with myself.
Well, I'll start that one because that was a fun one. I do remember I was on my way. I used to teach health policy in the School of Nursing, and I was on my way to my nursing class, and I saw someone who's now retired, but full professor and clinician, and she says to me on the street, like, Kevin, I just admire you because you say some stuff that I literally know I can't say. And she was an African-American woman, the whole nine. And it was just like, literally, she just said, listen, protect your peace and know that it's a lot of people supporting you. Right. And I remember that comment because that was when I was fresh and early. That was when I was like, it's not scared of anything. And then it wasn't the outward stuff that made me a little shaky. It was the moments and times where you were expected as an early career person to just say it perfectly. And if you can't say it perfectly, that means you have no idea. If you can't say it perfectly, or if there's any question at all, not as though everything, 90% of what you said was cogent, clear, and made sense, but it's that little 10% that everybody focused on that made everybody run. So what I would say to that person that's beginning, learn how to learn. Learn how to understand the room. You're going to need more social soft skills in order to do equity work. That has nothing to do with your empiricism and your ability to investigate. What I would argue is it's all about your ability to hear what the pain points are and reframe. Megan Lane Fall is she will never say this, but I tell you this every time. She's one of the best people at reframing. When she hears it, she can immediately take what she heard and translate it into something that everybody can understand. The issue is we have been too scholarly, erudite when it comes to the equity work. Leave all those big words out. How do we translate to the people? How am I going to go into a room? It was my second year at Penn, first year in my postdoc, and I get housed in the Division of General Internal Medicine. And I'm given the opportunity to do a presentation, and there was like 2 people with a PhD, and one of those 2 was a PhD MD, right? So it was just like, I'm shook. Like I'm in this room, and I'm talking about racism in medicine in 2016, 2015. Like nobody was listening to that. So when you're doing this presentation and no one says a word, that was the problem. Like you would think, like sometimes it's about the questions and the engagement, but most of the time I do presentations, I don't get questions. It is when I go meet with my mentors, a bunch of people that have gone and talked to the mentors that won't talk to me, that won't engage me, that won't ever tell me, hey, you should look at this. What we also have to remember is not a lot of people will engage you. right? Because it's a caustic subject at times. It comes across as though, man, I don't know how to, jump on this bandwagon. I want to tell you this is wrong, or this can be better, but I don't want to create a fracture in your presentation. So understand as well, by keeping silent in those presentations, you're hurting the development of that young scholar. So as the young scholar, don't take it personally when people won't actually tell you to your face. Because if you do, you end up like I did, where I had 2 years of no productivity because my mind wouldn't allow me to wake up in the morning and be me. When I'm telling my own students about pen face, I had it too. And again, I go back to Megan because the cafe conversations they were exactly what I needed, right? And again, when you're early in your career, it's easy to simply say, I want to leave, right? But there's something about the fact I can say I've been at Penn since 2015. There's something about that fact. And I've been here doing it the way I wanted to do it. So I just want you to know that as well. Like, there's no second place in doing equity work. You just have to be strong enough and know you got to take a couple on the chin. But learn how to take a hit and be okay. Okay?
Thank you.
Yeah, I mean, I can just respond quickly. I mean, I don't think I've actually figured this out quite well, and especially how to focus, right? I mean, I think this is the challenge because the issues are so great that there's so many different pathways that this work can take you. And so, anyways, that's all to say, I have not figured this out. But the other thing that I think I have realized more of is that, like, I don't have to do it all, right? That I think there's ways that you can figure out like what your strengths are and what you're especially positioned to do as a scholar and a researcher and an advocate, and those things that you can collaborate with folks of, that you can support their work and use your work in service of their efforts. So, that to me has been reaffirming in the sense that realizing that, like, I don't have to have all the answers, that there's experts, advocates, folks on the ground that are experts that I can talk to. And so, so I'm thinking about this as an example. I had done some work a couple of years ago, and it picked back up during COVID, thinking about evictions as a really key determinant of population health that is like incredibly inequitably distributed. It's under, it's an incredibly pernicious form of loss for individuals and families. And I was thinking about this from a really structural perspective, right? Like trying to think about how economic exploitation and racism pattern evictions in the population in ways that generate health inequity. So pretty big, like macro structural thing. When COVID hit and states and localities were putting in eviction bans as an example, right? Like this is an example of like turning the fire hose off for a second, a short-term fix, but that we saw tremendous amounts of benefit from, right? Like when places put evictions bans in during COVID, people did better, that the financial pressures were alleviated, COVID transmission rates went down. I have a paper that looked at mental health when that happened, right? Knowing that that's like a short-term fix, but thinking about that as like evidence for rethinking like how we allocate housing and how we can think about social housing in the United States, right? And so how can I then talk with folks, for example, at the National Low Income Housing Coalition, who again are like experts at how do we translate the science in ways that will result in movements and policy action around evictions, right? And so that's all to say, like, for me, it was a bit liberating to realize like that I can keep the big structural problems in mind, right? While also working on like a specific policy issue at the time, because I could also be in conversation with folks like who were the real experts and sort of like the political movements behind some of these efforts. So that's all to say, I haven't quite figured this out, but I think like trying to trying to think about, like, we all only have so much time and energy in our days, right? But how can we lift up and support the work of organizers, researchers, advocates, who can fill sort of other gaps that we might not be able to take on sort of personally and individually.
That makes sense. Those seem really helpful. And I think from Kevin, thinking about knowing your audience, knowing what your message should look like, having people to reality test with, and I'm proud that I have been one of those people for Kevin, but also being able to take one on the chin. I agree. It can get tiring. And then Courtney, I think you had some gems too in thinking about how to divide your effort, how to partner with folks. There's a concept from leadership of knowing how to follow and how to be a follower, how to support. And I think especially at a place like Penn, so many of us are used to leading and wanting to like lead the charge for everything, but there are really meaningful ways that we can support other groups and other folks. And in the spirit of that, thinking about supporting and partnering with folks, I'm curious what thoughts you all have about how to partner meaningfully with people in doing equity related work. Because this is something we do in implementation science. We talk about it being stakeholder engaged, stakeholder partnered. There's an increasing appreciation for equity. I personally have seen a lot of people talk about equity and talk about stakeholder engagement, patient engagement, and they put somebody on their grant, but that they don't actually want to talk to them or engage them. Like they want to bring them in later and just get the check mark. But how has that played out for you all? How can you tell me about some of the partnered work that you've done and tips that you might have on doing that effectively and meaningfully?
I can just jump in and talk a little bit about suicide prevention work that I'm doing. So I think in terms of some of my work where I've been interested is better identifying where our local priorities around suicide prevention and better understanding from the perspective of families, like what matters to them. I think in terms of a current project I'm working on, I think getting initial engagement from, I'm doing work within health systems, from a patient advisory board in terms of my interview guide, the questions I'm asking, as well as local organizations on the ground that are doing this work, having that early engagement when I'm thinking about study design, and also just fundamentally the interview questions I'm asking, how I'm going about recruitment methods was, I think, really valuable and kind of allowed me to course correct in many ways. And kind of question my own assumptions that I was making as I was starting to go about this work and kind of probing around a really sensitive and highly stigmatized topic area. And then other things I've been thinking about is to Megan's point around how we're really explicitly incorporating diverse perspectives within our teams. And again, early in the process, for my work with qualitative analysis, I think having those different perspectives in the analytic process, I mean, is absolutely critical to really be able to interpret and situate what I'm finding. But then also thinking about like beyond in terms of dissemination. Part of the qual interviews, I've been asking participants, like, would you like our results back? Like, are you interested in what we learned from this? And every single person has said, yeah, like I've never been asked that. I'd love to learn that. And so one of the things that's been on my mind is, what does dissemination look like, not just to a funder, but back to our participants. And so thinking about like how those results are framed, how we're communicating and reaching people in ways that is impactful for their own lives. And then the work I'm doing from American Foundation for Suicide Prevention, I think there's like lots of opportunities to think about how we can disseminate through local events online, but then also building in a policy dissemination aspect. How does those work really potentially extend beyond the academic sphere in terms of our presentations or publications, and then translate into potential change beyond the immediate project or building blocks that, again, address not just perhaps my own priorities, but those that really matter to families that are being impacted by suicide.
I'm happy to share on my end. We're working currently on a study in CHOP, actually, that's looking at racism in pediatric diabetes. And really, it's been a strong piece, because it's a question of having to look at, as the providers, there's an arm for providers. We have an arm that's directly looking with the advisory board, which is a caregiver-driven advisory board. And then we have actual caregiver interviews where, or excuse me, focus groups, where they come in and share their experiences. And this was one of those moments in getting this off the ground. It took everybody leaving their ego at the door, you know, and I think that's something really important, because at times, when we're doing this type of work for specific to racism focused work, like, you have to make sure clinicians don't feel like you're calling them racist. But in the same regard, what was amazing was listening to parents and caregivers say at a general space, like, that's actually not my story. So if you would have run from the conversation, you wouldn't have found out that you weren't as bad as you thought you were. Right. So that's one of those moments that I think is a really cool collaboration that we have ongoing. We have a meeting tomorrow, actually. Another one was, like I mentioned earlier, the Pennsylvania Coalition Against Rape. This was an equity-focused study that really highlighted the fact that persons that are living with intellectual developmental disabilities, those who come from that are within the LGBTQIA community, those experiencing living without a home, and specifically African-American women and girls, are at such high risk of sexual violence. And when we have these conversations, unfortunately, you know, the equity part of the conversation is, again, how are we using your reach for this group, right? For these groups, how does that reach look, whether you're close to Philadelphia or in the center part of the state or deep in coal country? How does it look? And what we found is it looks really different. But also we know that, and I think, you know, going back to Courtney's political conversation, you know, politics mattered greatly when it came to the vision and view and perspective of sexual violence and assault, where you were seeing police chiefs throw cases in the trash, literally, where there was a guy that was like a nurse and a paramedic still working. Right. So these are those kinds of conversations. So how do you bridge equity? So we talked about partnerships. We're partnering with healthcare systems, because we know that advocacy has to happen, particularly within emergency and critical care units. We also know that these conversations aren't happening when you have one person that's trained by they call them crisis centers, but rape crisis centers, sexual violence crisis centers. If you only have one person trained in that hospital and they leave, you're not reporting sexual assault, right? And that's some of the stuff that we've been able to find. So it's been a very interesting conversation. And the truth is, most of the large policy implications, as much as we need state level shifts, I would also suggest that we have institutional policy baked in to our implementation science conversations. What can we do at the institutional level? Because it's those conversations when your hospital CEO doesn't believe in it equates Me Too and sexual violence together, then guess what? They're not doing trainings in that respective hospital. That's structural. So those are some of the things that we've been working on. So glad to hear the others.
Yeah, I can just keep my comments really brief. Those are great reflections by Katie and Kevin. You know, one thing that I can say that I've tried to be better at recently, and can give an example of this, is trying to think about, you know, Megan, I think you made a great point, which is like, when we think about engagement, it's before we do the research, right? I mean, it's along the way. It's from like, what questions do we ask to begin with, to what methods we use, to thinking about data collection, to dissemination, right? So it's along the way, you know, and I think that matters in policy work too, which is more probably some of the work that I've been doing. So I can give an example of what I mean by that, which is, so I'm working with a colleague, Athene Venkataramani at the medical school, on a project where we were sort of broadly interested in how incarceration policies shaped health over the past 60 years of the mass incarceration crisis in the United States. And before we submitted a grant and really sketched out our design, we had calls with like a number of advocacy groups and organizations working in that space to figure out what they saw as like the most important issues, and also the ones where they thought there was like a potential political opening, right, where a policy change could happen. And so that was super helpful for us, right? I mean, it brought insights that we otherwise just wouldn't have got, right? Like they were telling us that like state policy, there's like a lot of potential action happening now. States, not for good reasons, not for the reasons of empathy that Kevin mentioned in the beginning of the call, but states were spending a tremendous amount on incarcerating and caging people, and it wasn't a viable financial position for them anymore. And so wanted to decarcerate for those reasons, right? So not maybe this empathetic reason that we might hope, but that states were interested in decarcerating sometimes, and that by focusing on like what are the state policy levers that they could pull that would have, you know, beneficial population health impacts as well as impacts on the status of the incarceration crisis, was something that was really helpful, and I think wouldn't have been possible if we hadn't engaged in those early conversations before the research questions were even solidified. So I'll stop there.
I love the idea of engaging with communities to understand what viable questions might look like. And as I think about engaging communities sort of in the developmental phase of research, I reflect on the idea that the communities that we want to partner with are pretty savvy, right? And sometimes you'll go to communities and you'll say, you know, I'm from Penn, I'm here to help. You don't say it like that, but they go, oh, it's, you know, it's another one of those researchers. Like, we've seen you before. You're only here to take what you can get from us. How do you start to build trust with communities that you might want to partner with, and try to get away from that and avoid reliving that legacy of sort of going in and pillaging and then leaving?
It's an away game, right? Like when this equity work, it's an away game. And if we are trying to invite people to see our pretty buildings and clean glass, I can promise you they're not showing up at the rates you want them to. We've got to be in places not once, not just with me and just me only. Like when we're doing these partnerships, it means something when everybody can come to the table. It means something when we have our higher ups or an associate dean or something that can come and shake those hands as well. It means something when they can kind of see and have that first maybe conversation or two kind of saying, hey, this was my experience with Penn. That's what I get every single time. Oh my gosh, I've literally met a guy that literally was like, Penn still owes me $500 from the study that I participated in 15 years ago. Literally said this to me. I was done. I was dying laughing, but I was like, my bad, man, but you're not getting that 500 from me, right? Like, it's not coming. But then also, I think it's important to remember that in that partnership experience, there's going to become a moment where it changes. And we have to be patient enough to remember that, unfortunately and fortunately, we represent that Penn brand. And when we represent that brand, we don't have to immediately say, I didn't do it. Like, just take it. Just let them say what they have to say, and then explain to them, these are the steps that I would like to take. And then I would argue, then we go a little bit further and say, look, what can we do? What can we do to make sure that you feel comfortable with not only how we're presenting the results, but maybe it's not an academic presentation that they need. Maybe it's a presentation that's surrounding like the 2-minute TikTok style presentation that we can get them to participate and help us with. So again, thinking about the translational research, the opportunities that exist by really kind of empowering and flipping it back to people, that also strengthens the partnership and give them that whole cachet of translational work so we don't have to do it and we don't have to get in the way of it. And one last piece that we talked through with the COVID work we did was video. For so many people talking about social media tools, not everybody knows how to use their cameras. Not everybody knows how to record without covering the mic and stuff like that. Verizon, Sprint, T-Mobile, all of these companies would love to partner with you for free to show people we can have our own traveling genius bar, y'all. Like literally, we could have our own ways to show people how to use and do best practices when it comes to just using their phones. So those are simple things that you can do as well that can make it fun, engaging, so that we're not continuing to create solutions that are technologically based that may again create more inequity because of a lack of access.
That's great. So I want to invite folks to put questions in the chat. We have one person who's asked about dissemination and a couple of our panelists who have mentioned dissemination. So what are some of the things that we should be considering as people who are doing implementation science or implementation science adjacent work as we are communicating with stakeholders? Keeping equity in mind, keeping literacy in mind, numeracy, preferences for receiving information. Do you have any tips for folks on how to get information out there?
People how they want information and how they appreciate having it received in a way that works for them. And I think there's like lots of opportunities. I think we do so much work that's written, but how can we move towards more creative visual representation? How can we partner with graphic designers and folks that are being really creative in how they think about disseminating this work? And also, I think how can we condense? How can we think about really what are our main takeaways from the work that we're doing that have salience, that are meaningful, that matter? And I think that that's where that we can maybe make some strides in having our dissemination have more impact and have it be more tailored. And I don't think there's one necessarily way to disseminate. Maybe we have one study, but dissemination segments may look very different based on people's preferences for how they receive information or the key elements that matter most for them. So I wonder too if there's ways we can maybe think about dissemination early on in our design and maybe start to incorporate how we think about baking in those preferences early on so that we can have thoughtful dissemination plans as we're moving further along in our processes to get the work out there. And I think is a way of really continuing that partnership from the point the study ends and circling back and sharing people's results with them.
Yeah, I can echo that. I mean, I think part of this is exactly what Katie said, which I don't think like there is one dissemination strategy, right? And I think it has to be tailored, and we can think about it as the folks that participated in our research. We can think about it for policymakers or for advocates, and these are all different strategies that I think we should think about at the get-go, not at the end of the work. I know, Megan, you just put something in the chat about, about a good resource for folks thinking about these issues. My sense too is, there are so many great folks for those doing the work at Penn, thinking about these issues, including folks at LDI. I know in my own work, they've been just super helpful in thinking about how can we draft policy briefs and blogs and reach out to policymakers and advocates, right? In ways that, they're the experts. And so I've really followed some of their lead in that sense.
Well, from the work we've done, and I think it's just important in the waning moments I know we have left, I'll be short, but I think it's important for me. What I had to do was find my place of comfort with my voice, because my voice was mishandled when I was doing this work early. And it took George Floyd to die on camera for people to start kind of opening their eyes and checking in and asking me, am I okay? And all those kinds of things, but it took a lot. So I put a lot of pressure on the academic peer-reviewed dissemination, forgetting that we also do the other stuff. We do the op-eds. We're always doing media. I'm always in the community. I'm always working with churches and working with states, hospital associations, or legislators. So I had to also remember that I'm doing the work too. Systematize it so you know that you have avenues when those results come out. Now you've got reporters at multiple outlets that you can reach out to. Learning that there's a difference between the Twitter kind of blog posts that you create or posts that you create versus Facebook. You got way more space and time on Facebook. But you need that savviness going in between that and Instagram. Instagram is a picture. Give me what you got. Like, how do you use these points of conversation to drive these messages. And you do that by thinking about, I like to think about, what are the people who are in my corner who are going to high five everything I say? What are they going to want to make sure that I say today? Then I'm going to say, what are the people who don't care at all about this work and they're going to nitpick everything up here? What are they going to say? And what you have to do, the same way you anticipate reviewer 2, you need to anticipate how these folks are going to act in these sessions. They're not going to come across like, oh, upset and mean. It's going to be like, well, wait a minute, I have another question. And it's going to turn into that, like, what are you really asking me, right? So sometimes you have to learn how to also remember those things can be detrimental to the conversation. So think through it already. Disaggregate your slides so that you don't have more than only 1 point per slide. That's what I was told when I got here. When Dorothy Roberts sat me down and helped me understand, because you all know, if you know Dorothy, her writing, how she speaks compared to how she writes, she is 7 feet tall in her pages. But she also is this sweet person that has that demeanor that's like, look, I don't play, but I also want you to know we have to remember who we're talking to. And that's something she gave me a lot of really credibility to do. And I just challenge everybody, like, do not run from the opportunity to help people learn. If it hurts, it hurts. But you can be 10 toes down, you can stand there and take it, because you can't make somebody change a behavior as a mindset that they've literally had all their lives in one talk. Don't wear that weight on you. Use your translational work to keep doing the work.
Well, I think that's an outstanding place to draw us to a close. And I'm so grateful to our panelists for bringing their expertise and their insights to this discussion of equity and implementation science. I have learned a lot from all of you, and I appreciate it. Thinking about, I love the concept of this being an away game, equity being an away game, right? If you're going to engage folks, you need to go to where they are. You need to talk in ways that are meaningful, and you need to address questions that are of interest to them, which I think were points that you all touched on. I also think that, Kevin, the concept of reaching up and who we decide to reach for and whose needs we pay attention to is particularly evocative. So as we draw everything to a close, we've got our email address in the chat. Feel free to send us questions if you have them. Feel free to reach out to our panelists. And thank you all so much for your time, and have a wonderful rest of the afternoon.